All right, everybody. So we're going to go ahead and go over Chapter 7, Medical Terminology. It is a very short chapter. It is a whole whopping 36 slides. Um, so this one will be rather short, sweet, to the point. And then we're going to go ahead and get into Chapter 8. But one of the things I want to touch on with medical terminology with you guys, and I'm not saying anybody in this class does that, so please don't take it this way. Um, but with medical terminology, a lot of the times what we notice is people often try to use bigger words than what they actually understand. With that being said, don't be that provider. There are certain things that I know because my mind goes 800 million miles an hour, and I will jumble words up at times. So I always just try to keep everything short, sweet, to the point. The old KISS analogy, if you will, keep it simple, stupid. It was one of the first things that my very first partner in EMS ever taught me is, don't go saying a bunch of shit that you're just going to mess up because then you don't look like a competent provider. And we don't want that. We want everybody to be able to get through everything, say that you need to. And, you don't need a $25 word to make a $2 point is always the way that I was put. Always the way I was taught, I should say. Um, So with medical terminology, one of the questions, believe it or not, that you can actually be asked on registry is the root of medical terminology comes from, and it is actually Latin and ancient Greek. Um, there's abbreviations, there's conversions, there's all this crazy stuff. Um, so we're gonna try to get through it. We'll break some of it down. Again, you're gonna notice when I hit these, some of these like these here. Um, I'm not going to sit here and read every single one of these to you. So we'll go over them. These are things that you guys have access to if you want to go ahead and make notes over this. Rewatch this video, go through the chapters on Brady Lab. It's all things that you can do. It's just if I sit here and I would go, gland, cancer, heart, cell, skin, small intestine, female, blood, water. And if I go over all of those, you're going to be tired of hearing my voice and you're not going to want to pay attention to it. But a root word is a foundation of a medical term. Prefix is placed at the beginning of a root word to modify the meaning. The suffix is placed at the end of a root word to modify a meaning. And a combining vowel connects root words to a suffix or combines two root words together. So like this here, you have your root and combining form, you have your meaning, you have your example. So, you know, um, like cardio is heart. Example, cardiomegalia is the enlargement of the heart. Um, dermato, skin, dermatitis, which is the inflammation of the skin. These are good words to know, though, because you're going to see these things. So, if you work private EMS, you're bound to go to a nursing home, or if you have a nursing home in your responding district of your fire departments, a lot of the times you're going to get, depending on your dispatch, you're going to get dispatched, male patient, uncontrollable epistaxis. Well, if you don't know what epistaxis means, you might be going in there with everything when in all reality it's just a nosebleed. Like hemato, it's blood. Hematoma is a blood tumor, and it's literally referring to a collection of blood within a tissue. So, path or patho, which is the disease, pathogenic, disease causing. So again, they're good words to go over and to remember. Um, you know, it's going to benefit you as a provider. So, you know, when we talk about some of these words here, these are more or less some of the things that you may see, like hemi or hemi is half, so hemiparesis, hemiparalysis. Um, those are good things to know. Hemi means half, semi means half or partial. Obviously, uni is one, mono is one. So, unilateral is one side. Mono or can also mean one. Monocular can mean that it's pertaining to one eye. So, bi means two, which is so biphasic, occurring in two phases. Tri means three, triceps, muscle with three heads, so on and so forth. Quad means four. So if you see they're quadriplegic, that means that's affecting all four extremities. So multi, means many. So if you see multi-organ failure, you have more than one organ system failing. Now these are um, also some words that are good to kind of know. So just the letter A. So afebrile means without fever. Um, also can mean without, but anura, anura means without urine. Um, anti, so meaning anti or against, anticoagulant, against clotting. So your anticoagulants keep you from clotting, but you need to understand that anti can mean against. Brady means slow, so bradycardia, bradykapnia, things like this. You need to know that Brady means slow, just like you need to know tachy means fast. Hyper means above or over, so hypertension means high blood pressure. Hypo, under or below, so hypotension means low blood pressure. When you see words like intra, that means within, so intraocular means within the eye. So again, some of the good words to know, like macro and micro. Macro means large, macro drips, micro drips. Neo means new, so neonate. Um, Oh, what's another good one to bring up? So like pseudo means false. You'll hear people say like pseudo seizures. Usually means they're having a fake seizure. You don't want to be that person in the back of the ambulance going, "Oh, they're having a fake seizure here." No, they're having a pseudo seizure, and a lot of the public doesn't quite understand what you mean when you say that. Or like when we say retroperitoneal. Retro means back. So retroperitoneal literally means like the backside of your abdomen, your chest area, things like that. Um, because for whatever reason, and I've never understood this in all the years that I've done EMS, you get to the nurse, they're having retroperitoneal pain. What? At 3 o'clock in the morning when my brain's only working at 25% function until I fully wake up. And you get nurses, the nursing home nurses that's throwing around those words. It amazes me because then I love it. Like, you go to the hospital and you get your ER nurses and, oh, hey, their back hurts, their stomach hurts. We all get it. We're not going to try to use all the fancy terminology. Again, you don't need a $2 word for a $2 meaning. Supra or super means above or over. So, like supraventricular tachycardia, it is a, lethal heart rhythm, but it means fast. And it also means, like this supraventricular, it's above the ventricles of the heart. So it's a fast heart rate occurring above the ventricles. Yeah. So this is going to be a very quick set of slides we're going to go through here. Um, Again, for me to sit here and read all these to you is not going to work. Um, we'll go over some of them. Like when you hear the word ectomy, It usually means the surgical removal of something. Um, so when you get pulmonectomy, it's the surgical removal of a lung. So if you ever see ectomy at the end of something, you just know that it means a surgical removal of. Um, when you on this one, where's it at? Like medulla, so spleen medulla, so you'll get like the enlargement of the spleen, so splenomegalia, like I just said. Um, Again, if the suffix IA is the state or condition, so tachycardia, so your IA is at the end, it's a state of having a fast heart rate. Again, knowing knowing all of these isn't necessarily essential, but knowing some of them are, you know. Um, Osis, um, the it's an abnormal condition, so cyanosis obviously means the abnormal condition of being blue, an indication of lack of oxygen. Um, so let's see. So like pathy means disease. So cardiopathy is a disease of the heart. Plasty is a surgical repair of, so rhinoplasty or rhinoplastia is a surgical repair of the nose. Again, I am very, very sorry. This is a horrible freaking ta chapter to teach, and I know that it's a horrible chapter to learn, um, because I just don't feel that sitting here reading each and every one of these to you guys is going to do it. So what I will do, I will send this video out, and when I send it out, I will also attach these slides with it so that you can go through, if there's words that you want to write down, go ahead. I promise you, I'm the one who writes the test. When we talk medical terminology, um, it's not going to be breaking stuff down like this. It's more or less going to be, inferior, superior, knowing the different things like that. But it's not going to be asking for the definition. You're just going to have to be able to pick out, okay, so they're talking about the inferior portion of this, without giving you guys a question and answer, but, or, you know, um, the superior vena cava, things like that. It's more or less going to be able to identify certain words and their generalized meaning, not breaking down suffixes and meanings, and it's not going to be like that. So here is a big thing, and I'm going to tell you, I am one of the most dyslexic people in the entire world, I swear. Um, and I literally just found that out about 10 years ago now. Um, so it makes spelling um, a challenge sometimes, but proper spelling um, is extremely important for documentation. And nowadays, we have the luxury of electronic charting. So you can have spell check and we have AI generated narratives and all these kind of beautiful things. But you also have to know proper grammar. We don't want run-on sentences. We don't want to contradict ourselves in our narratives and our reports as well. So using the proper words and the proper punctuation and the proper spelling is very, very, very important. Um, you always want to avoid jargon or slang. So, um, what I always tell everybody, the golden rule, is if it's not a basic um, abbreviation or a commonly used abbreviation, don't use it. Um, One of the charts that I QA'd one time that just comes back to mind to use for an example for you guys. Um, we took a high school basketball player um, who jumped, got hit. When he come down, he ended up breaking his leg. Um, and the person who wrote the report actually put basketball playa, not player, but playa. And when I sent it back, um, I said, this isn't an acceptable abbreviation or um, even an acceptable word replacement. He goes, well, I don't say player, I say playa. So that's how I'm leaving it. And actually, that case ended up going to court um, for a couple different reasons. And he pretty much got discredited on the stand because that wasn't the only word swap in the report. But, even I remember early on being an ALS provider, I had a homicide in Youngstown. Um, he died after the fact at the hospital, but when we went to court, um, there was a very few things in my narrative that I had abbreviated, um, and because of that, I um, I had to explain each and every one of them, and I swore after that um, I would never abbreviate that much again because at the end of the day, if I have to sit there and I have to try to remember every single thing that I'm trying to abbreviate, at that time, it doesn't take much longer instead of putting U/A for upon arrival, just to put upon arrival, or requested for medic B/U for backup, just to put backup. Um, it's just sometimes it's better off just to take the extra time it takes, fully type out a word, make sure we're using, again, the proper punctuation, commas and periods. Listen, as someone who does QA, there is nothing worse than run-on sentences and a patient care report. You would be amazed at what proper punctuation will do. Um, so Again, I'm not going to go over these. Like I said, I'll post these slides for you guys. But um, so we talk anatomical terms. This is referring to terms of the position and direction um, for specific identification of the areas of the body. I want you to remember something. If you remember nothing else that I say out of these slides, remember this. When we talk any position of the body, we are always referring to the body in its anatomical position. So remember, this is a patient standing erect, palms facing forward. So if we have an injury to the right forearm, and it's on what is going to be the anterior portion, and you're looking at this lady here, this is the anterior portion of the arm. This is what we can see. So this is our anatomically correct position of the body. They're standing erect, palms forward. We know that the midline is the line that cuts straight down the body. That distal means away from, proximal means closer to. So I have a distal radius fracture. It means away from. Proximal humerus fracture means in the direction closest to. Um, so when we talk lateral, we're talking the sides. Medial means in the middle. So I'm having medial chest pain, means towards the middle. I'm having right lateral flank pain, means on the side of. When we talk mid-axillary, this is a line that is drawn straight down pretty much the middle of the armpit, straight down the side, straight down the legs. This is very important to remember because as an advanced EMT, you are now allowed to do what we call a needle decompression. One of the sites is fifth and sixth mid-axillary. Remember, superior means up top, inferior is at the bottom. You never want to make yourself feel superior by making someone else feel inferior is the way that I was taught this. That means that you never want to make yourself feel on top by making somebody else feel on the bottom. So always remember, superior is over inferior. So again, this is a point of reference for the anatomical position, which is we're standing up, facing forward, palms turned out. So you have your transverse plane, your sagittal plane, which is your median plane, and your frontal plane, um, which is just the three ways that we can cut the body apart pretty much when we're talking about things. Um, again, go back, medial, middle, lateral, outside, proximal, closer to, distal, away from, mid-axillary, straight down the middle of the armpit, straight down, instead of worrying about breaking it down into planes. So your head is referred to your head is referred to as your cranial cavity. Everything in the spinal column is referred to as the spinal cavity. Your chest is your thoracic cavity. You obviously everybody knows your diaphragm. Your stomach and all that is your abdominal cavity. Your lower is your abdominal pelvic cavity, and then lower, right above the groin region, is your pelvic cavity, and on now. So remember this. I'm going to tell you this right now. So again, remember some of these. Abduction and adduction are testable questions, and you're going to see this all throughout class on tests that you do. Abduction is moving away from, I want you to think of that as taking away. Adduction is movement towards the midline. We're adding it to. So abduction is lifting the arm out to the outside. Adduction, we're lowering the arm back to the side of the body. So abduction, we're taking away. Adduction, we're adding to. Anterior is towards the front. The apex is the tip of the structure. The base is the lower part of the structure. And your caudal is towards the tail, like the humerus. And in humans, that is the feet. Sorry. I literally just am mumbling my words today. Um, so like, we talk the apex. The apex of the heart, it points downward. Um, when we talk about like the base, the lower part of the structure, the bases of the lungs. So when we listen to lung sounds, we have upper, which is the apex, and the base, which is the lower of the lungs. Um, Again, we can just say upper and lower lung sounds, but you may hear him say, well, the apex lung sounds. That's the upper lung sounds. Um, Deep, when they talk about deep, we're talking about toward the inside of the body. Distal is away from the midline or other point of reference. Again, the foot is distal to the knee. Dorsal, when we talk dorsal, I want you to think of like a shark. Its dorsal fin is on the back. Dorsal means posterior or toward the back. Extension means straightening a joint to move the two parts further apart. And flexation, I want you to think about like you're flexing your muscles. You're bending a joint and bringing the two parts closer together. So we're bringing our forearm closer to our bicep. Inferior means below. Lateral means towards the side, away from the midline. Medial, again, is the midline or the middle. We already said what the midline is. Posterior is towards the back. Remember, think a shark. Dorsal. Dorsal and posterior have the same meaning pretty much. Prone means you're laying face down. Proximal just means near the midline. Superficial is towards the outer surface of the body. So if they have a superficial laceration, it just means it's a minor cut. It's really not deep into the tissue. We already talked about superior. Supine is just them laying on their back. And ventral is towards the front or the anterior portion of something. Proper patient position can reduce pain and improve breathing and increase patient comfort. So the different positions that you can see that are usually documented are prone, left lateral recumbent, right lateral recumbent, supine, the Fowler's position, or semi-Fowler. 95% of the time, the patient prefers to be in a semi-Fowler or a full Fowler position, especially our respiratory patients. We're never laying them, supine. We never transport a patient prone. That is how you kill somebody. And left and right lateral recumbent just simply means on the left side, on the right side. Usually their knees are drawn up a little bit when they're in the right lateral, left lateral recumbent position. Um, each body system has a particular term associated with it. So, this is telling you which table goes with which body system. It's not going to be a bad idea to look these over once the slides are posted. Again, these aren't bad ones to know. See, and this is also why we are very careful what we abbreviate. PE, physical exam or physical education, pulmonary embolism. You know, I've watched people when they put PO for a route of medication, they put P period O. That's not the case. PO together means orally or by mouth. PT, again, that can also mean physical therapy or patient. All depends on how it's put and how it's used. Um, So if you get the Q with a line over it, it'll mean every, and then it'll tell you so often. But not all of these, but most of these are good to know, like R/O, rule out. PE, we refer to it as a pulmonary embolism. OB is obstetrics, so baby doctors. O2, oxygen. NTG is nitroglycerin. Um, so these aren't bad ones to know. If you get an S with a line over it, it means without. S/S is signs and symptoms. SIDS is sudden infant death syndrome. We'll get into that when we get into pediatrics, but SOB does not mean son of a bitch. It means shortness of breath. STAT means immediately. SX means symptoms. TIA, transient ischemia attack, a mini stroke. TKO, we'll go over that when we talk about IVs and IV fluids. That just means to keep open. Um, Y/O is year old. Arrow up, increased, arrow down, decreased. Not bad things to know. But again, there are common abbreviations used for charting. Um, Wherever that slide actually is. Um, so again, some of these terminologies are not bad to know. Um, just know, we have unique language and identifiers that are used. And this is also here's where I also want to tell you guys. Doctors will use one thing as an abbreviation. I know I have a couple nurses in here, you guys can definitely vouch for that. EMS, I always try to tell guys and girls, just try not to use too many abbreviations. If everybody doesn't know what it is, it means don't use it. All right, so that's the end of that one. So everything will be a separate recording with that. Um, so with that, I will end this video. I will start a new one. I will post these slides with this video, um, and it will be um, that way you guys can, watch the video and or just go over the slides. Again, I'm not overly concerned with too much of this medical terminology just because we'll get into more med term in each chapter that we get to. Just, some of the more common abbreviations are good ones to learn.